Welcome to Managing Fear. It takes courage to acknowledge that fear is often present at diagnosis and at times can be overwhelming. This session is designed to help you recognize the myriad of emotions you are experiencing and provide strategies for managing the emotions that can be destructive to the quality of your life. Elyse Adams is a licensed clinical social worker and is certified as an oncology social worker with novanthealth Cancer Institute Buddy Kemp Cancer Support Center. She is a woman-to-woman program coordinator, and her clinical practice focuses on providing counseling for patients and loved ones around managing the stress and trauma gynecologic cancer may bring. Thank you for sharing your insights and wisdom, Elyse. I turn it over to you now.
Hi, I'm Elyse Adams. I am a licensed clinical social worker and oncology social worker with Novant Health Cancer Institute Buddy Kemp Support Center. We're located in Charlotte, North Carolina. I provide individual counseling to clients, whether they're first diagnosed with cancer all the way through treatment or even post-treatment, knowing that for some people, emotions don't hit until much further along. We also provide caregiver supportive counseling at our Cancer Institute, knowing that cancer impacts different members in the family differently. So we want to be able to offer that support because this can be quite the emotional roller coaster. Our services also at Novant Health Buddy Kemp is we provide programming, lots of programming to help people. We have hypnosis, we have a drum circle, we have expressive arts with journaling, we have cooking demonstrations, lots of different things that we offer to just help people along the way, knowing that one tool might help one person that doesn't help the next person. The other services I offer at our Cancer Institute is I'm one of the women-to-women coordinators. We partner with OCRA. And so in that, we've started this through a grant from OCRA to pair newly diagnosed women with somebody who is post-treatment, a year post-treatment or more, to help provide support and understanding along the way. So today's presentation is managing the fear after diagnosis, with the idea that fear is normal and lots of emotions are compounded on top of the fear. So I'm going to hope to normalize that with you all today, and stick with me. We've got lots of coping tools and strategies along the way to manage that fear. So to start with, let's read over the objectives to define and increase understanding of fear in the context of cancer, to identify the thoughts and grief-related emotions common from time of diagnosis on such things such as anxiety and grief. And then lastly, and I put a star by this, to provide strategies and resources for coping with fear and other emotions. So next, let's just start at the very beginning of the definition of fear. Fear can be defined as being afraid of someone or something likely to be dangerous, painful, or threatening. The American Psychological Association defines fear as a rational reaction to a potentially dangerous event or object. So no, this certainly fits in the context of fear, right? And fear related to cancer. As we move forward, I'm going to provide a frame of reference by using two clients that I see. I've changed their names and their specific details to protect their anonymity, but I think this will help give you context also of what other people share with me along the way. What I know is, right, we need to normalize the impact of how it affects the individual, the family, relationships, work, and long-term well-being. In these examples, I'm going to start with time of diagnosis and then move through surgery, chemotherapy, and/or radiation, because the sequence varies for each person, and that's to be expected. But my hope is, again, to normalize your experience and provide you with support, coping techniques, and then at the end, more resources. So just here's going back to fear. Let's normalize common fears. I'm going to read them. So how will this affect my family? Can I handle the side effects? What if I can't work or afford treatment? Fears of recurrence and the real thing, scanxiety. What will my treatment plan be? Information based on your internet searches. Can I trust my provider's information? And then lastly, right, what if I don't survive? A real fear, but one that we want to talk about. As well, your caregivers and family members might be experiencing their own fears. In my experience, this is primarily trusting their loved one is receiving the best care from the provider, researching on their own the best practice, what to expect, who they should tell, managing their own work, family, and health care if needed. Who will provide support and how will they provide support? An area for so many of spouses and caregivers' fears is that they can't fix this. And so that balance of communication is so important, of just knowing they can't fix it, but they're there to provide support. So in my next slide on trauma, when you're diagnosed with cancer, what we talk about in our department is that being diagnosed with cancer is a trauma. It's traumatic. Trauma is defined as a deeply distressing or disturbing experience. And where there's trauma, there's grief. Grief doesn't just happen when somebody passes away. Grief is real. So in Elizabeth Kubler-Ross's book that so many of us have heard about, there's the 5 stages of grief. But what I like to talk about with clients is it's not linear. It doesn't go from start to finish, but more like bubbles that come in at different times, right? So we've got denial, anger, bargaining, depression, acceptance. You might go through all of these in the course of a day, right? Or a week, or throughout treatment. But different things may pop in and then subside. And that's okay. It's your body's ability, right, to process grief. We can't avoid this. It's going to actually help you along the way. So next, I'm going to move forward with our 2 examples of individuals that I've seen. So Mary is our first one, and I'll read this to you out loud. Mary's a 38-year-old woman married with 1 child, age 7. After months of infertility while trying to conceive a second child, an ovarian mass was discovered. Following further testing, Mary was diagnosed with ovarian cancer. She was referred to a gynecological oncologist who stated the need to schedule an immediate hysterectomy and oophorectomy. She would then begin 6 cycles of carboplatin and Taxol every 3 weeks following surgery. Feelings of heightened anxiety were evident, with difficulty sleeping, feeling nervous and anxious most days. As the sessions began, our focus was on taking the diagnosis literally 1 step at a time. Fears of our own mortality were processed. Then secondly, we've got Elaine. Elaine's a 60-year-old woman who had recently retired along with her husband. Elaine had been employed for many years and was looking forward to traveling. Elaine had been experiencing bloating and had relayed this to her primary care physician, her PCP. After 6 months, her doctor finally scheduled her for testing. Ovarian cancer was diagnosed with the plan for surgery and chemotherapy followed by radiation. Elaine described in our initial session how surreal everything felt. She was experiencing the why me question. She stated it felt like all of the air had been sucked out of the room when the oncologist said the word cancer. So these 2 ladies' stories are right, all too familiar, and just 2 of many. Many of you may relate to their story or have been through something similar. Many women, along with those close to them, were experiencing this same fear at the time of diagnosis. So moving on to the next steps, let's normalize this fear and talk about coping tools specifically for the surgery. So specifically, what will surgery involve? What will recovery look like? How to heal? And as the bullet points, right, focusing on things within your control can be helpful. Books can be helpful along the way to explain cancer to children. Books on preparing for surgery. And then again, within things within your control, organizing support, meal trains, etc. So using our examples, right, with Elaine and with Mary, they both experienced this. So at the very beginning, talking about the books, I recommended a book called Preparing for Surgery, Heal Faster by Peggy Huddleston. And I put this at the end of the presentation and the resources. You don't need to write it down now. But the idea, the takeaways from this book are Visualizations can be helpful. Picturing yourself on the other side of surgery and what that will look like. Picturing yourself home, comfortable in your own bed, right? What will you need to make that happen? As people say to you, right, you're in my thoughts, I'll be praying for you. For some people, that's helpful. For other people, it doesn't quite resonate. But literally trying to hear that is, right, people bringing you comfort. Those are important takeaways. Having an affirmation statement can be another takeaway that you sort of repeat prior to surgery. You can have your surgeon as well repeat this going into surgery, whether it's faith-based, or another affirmation. As Mary discussed in her initial session, we want to reframe some of those thoughts, put them in perspective. Things that are within your control of, do you need to get clothing that has either loose waistlines or casual dresses, rompers as you're healing from surgery? Childcare. Do you need to put in place childcare resources? Do you need to put in place a meal train? Things that are going to be helpful for you. There's also those feelings of grief like we talked about and Elaine had mentioned to me. Conversations with your oncologist can really cement that the answer of the why me, there isn't an answer, there isn't a cause. Cancer just happens. I see clients all the time that eat as healthy as they can, eat vegan, run marathons. Cancer just happens. So we want to do whatever we can to remove the feelings of blame, shame, guilt. Those are not helpful, right? As we're trying to feel like we can manage this. Giving yourself permission to relieve that feeling of guilt is instrumental. So for Mary, there's also the piece that I had mentioned, that she won't be able to be pregnant with further children. I see many ladies who receive this information, and I tell you, it's right, the most gut-punching, pull the rug out from under you emotion to be told that, right, you're not going to be able to be pregnant. So with this fear, right, staying in the present, having an outlet to process that emotion. I often say, right, it's important to voice these fears and this grief out loud. When we keep it inside, we can spin an entire narrative. Feelings are not facts, right? That's an important phrase. Feelings are not facts. It's important to process this out loud. And for Mary, journaling was a tool that really helped her. Fear with anxiety can also run high as people are awaiting surgery. How long will recovery be? Elaine disclosed, as I mentioned, that her husband, he might not be the best caregiver. So who will she lean on? Again, helpful coping can be, if she feels comfortable, finding somebody who has been through this diagnosis so she knows what to expect. So for Elaine, I tapped into our Women to Women program that I mentioned at the very beginning and paired her with a peer mentor who could help normalize what she was experiencing, share the tips and tricks that helped her along the way. And they texted as she went through surgery, treatment, etc., talked on the phone as well. And then lastly, right, if we recognize that her husband might not be the best caregiver or helping her with post-surgery healing, that's okay. Not every person can be everything to everyone, right? Who might be a better person that can help her with caregiving? Could her sister come in from out of town? So next slide. Normalizing the fear and the coping tools for chemotherapy and radiation moving forward. So some common fears are the getting the port, managing side effects, support and accepting help. So I encourage you, right, to talk to your providers regarding side effects. Be conscious if the internet and social media is providing hope or discouragement, and breaking it down to one treatment at a time, utilizing the word temporary. I'm going to explain that more in greater detail. So, right, both Mary and Elaine had rational fears of the side effects and the grief of knowing they'd lose their hair. Managing that is understandable. The word chemotherapy in and of itself is overwhelming and scary. So what happens so often is we go to what's familiar to us, whether that's a family member, a friend, a coworker, or what people share with us about somebody who's gone through this. And that can be helpful, or that can be, right, even more scary. I mean, goodness gracious, if you go off of what we see on TV or in the movies, that puts a lot of fear of us in us, that we're going to be frail and pale and hunched over a toilet all the time. And in first line treatment, right, most commonly it doesn't look like that. So just, right, getting that picture out of your head, but instead talking to your providers for what to expect. And when you go for that chemo teach appointment, bringing somebody with you so that they're able to be a second listening ear to process what's more realistic. Another piece that I find can be helpful is picturing chemo as a cycle downwards where side effects come in, and then hopefully as you anticipate next treatment, you're starting to heal and feel more like yourself. Okay. And then lastly, the word I talked about, temporary. That's an important word to know, that on your worst day, it's not going to feel like this for the next 6 months of treatment. Being able to put that in perspective. As treatment continues, different fears will come up. The importance of breaking it down to one treatment at a time. If that feels like too much, literally one step at a time. What do I need to do next? Do I need to give myself permission to rest? Solving this by taking it one treatment at a time can really make this feel more manageable. For Elaine, it included radiation. So moving back to one of the points I mentioned, be conscious if the internet and social media is providing hope or discouragement. Because what you might find is it's so tempting, right? Our phone is always within our arm's length. And you might go to reputable sites, but that still can be very overwhelming. A lot of information. So sort of recognizing, where do I need to hit pause and just get information from my providers? Again, going on social media sites, Facebook groups. We're so wanting information, but we also need to be conscious of, by the time we get off the internet, are our shoulders slumped? Do we feel drained and exhausted? I encourage you, right, when you have that awareness, to seek out the sites that give you hope and encouragement. Sometimes what I find is in those Facebook groups, the people that are posting are the people that are struggling the most. And that might be helpful for some people, but when you're new going through this, that's where you might need to put some boundaries in place. But moving forward, normalizing the fear and coping tools post-treatment, or if you have ongoing treatment. So important to normalize is that not everybody wants to ring the bell. Will you ring the bell? Fear of recurrence and scanxiety, right? This is all a topic in and of itself, of giving yourself grace as you acclimate to life post-treatment and healing, and focusing on things within your control. So the first piece about ringing the bell, right? It can be powerful. You can be surrounded by your loved ones and it be a very emotional experience. You don't have to decide that when you're taking on treatment number 1 if you're going to ring the bell. And to know other people have that concern also. That's your decision. Give yourself grace. As you're healing from treatment, recognizing that doesn't happen overnight either. I encourage people, right, to take it on a scale of 1 to 10. If, say, your energy level is a 4 out of 10 when you're completing treatment, what would a 5 or a 6 look like? Can we make this feel more manageable so that you feel like you're making steps? And the other piece really is truly to recognize we're not going to go back to who we were 100% post-surgery. Our whole life perspective has changed. And that can be okay. But really, what does we want it to feel like moving forward? Recognizing, where do we have triggers? Is it an anniversary of a diagnosis coming up? Is it Cancer Awareness Month, right? We want to normalize all these triggers so that when they happen, if they happen, you know that that's okay. It will subside. It will pass. Scanxiety is a real thing, right? As people are approaching their next scans. That's why we name it. And a piece that can be really helpful there is to look at it as the scan is to gather the information. Before you take your mindset to the what ifs, let's actually see what the scan shows. I had a client ask me the other day, how do I live my life knowing my cancer may return? What will help me? Right? So that fear of recurrence is real. It's not an easy answer, and I'm glad our hospital, for instance, offers counseling just to process this very thing. So let's move forward and start really diving deeper into coping tools. So coping tools that are within your control. First one, living intentionally in the present. Recognizing the unknown in the future is unknown, in the future, but not the what ifs. Forming a narrative that is not unfolded is not helpful. Focus instead on what's going to help you manage today, what might give you pleasure or comfort today, as well as noticing when have you gone down what we call the rabbit hole. Noticing intrusive thoughts, right? We can't prevent intrusive thoughts from coming in. I think that's a piece that we want to make clear, but we can get to know those intrusive thoughts in hopes of subsiding them. So one tool I like to talk about is grounding techniques with clients. Be where your feet are. A grounding technique that can be really useful is to tap into your 5 senses. You can try this outside. Try it with your kids or by yourself. But when we're feeling anxious or fearful and able to get some perspective outside of, what are 5 things I see? What are 4 things I can touch? 3 things I hear? 2 things I smell? 1 thing I can taste? Just having that awareness is literally will bring you to living intentionally in the present, grounding technique, and being where your feet are. Next, building your resiliency. I use a visualization of a water pitcher with clients where, right, you hear the word cancer, pour out some of the water. You find out your treatment plan, water. You undergo surgery, chemotherapy, radiation, again, water, pouring out. Then we've got our own life stressors happening along the way at the same time, whether we're working or with our spouse, our family, financial distress, all those things, right? By the time I've gone through all of that, right, there's no water. You're in fumes in the pitcher. So, right, figuring out what's going to help put some water back in, help build your resiliency with self-care. The term giving grace to yourself, putting boundaries in of what you do have energy for. Saying no is a complete sentence when people ask you to do something. It's okay. Another piece is, right, you only have so much energy. I talk about a cup, right, of so much energy and being intentional of where you use your energy. Activity pacing is the concept of, right, what's something that I know I need to do today versus what is something that doesn't have to be done today. And is there somebody else, for instance, that could just carry the laundry basket into another room for us so that we can save our energy to save it for something else that might have to happen today, like picking up your kids, for instance, from school. Paying attention to feelings of anxiety, number 3. Recognizing, like we talked about before, where are there intrusive thoughts coming in? Noticing the physical sensation of stress in our body. Do we feel like our shoulders are right up to our neck? Do we feel the tension in our shoulders, our neck, our back? That we need to tap into some tools to help provide relaxation. Can we try a breathing technique, a visualization? Another visualization that I use a lot with clients is picturing the ocean, right? The beach can be very calming for many of us. Visualizing the waves in the ocean. Some waves are small and some are larger, closer to shore. And we can compare that, right, to our fears and anxiety. Can we name it, right? I hear you fear, I hear you anxiety, and ride with those waves. They come in, they go out. Or the waves greater and closer to shore. But again, we ride them, we let them subside. We sort of feel them out, name them to tame them, and those go back. Picturing yourself, if this is helpful, right on a raft on that ocean, letting the anxiety and fear come in and letting it pass. Affirmations can be really helpful as well to pair with that. So I hope that's helpful, right? Additionally, let's talk about the question that Marianne Elaine posed about how not to think about cancer, the fear of recurrence daily. Managing that fear. A thought process is instead of fixating on the unknown is so tempting for people, but again, it's unknown. So instead, focus on things that are within your control. Number 4, seeking support, including counseling. So for some people, we have great support. We have lots of family, friends, coworkers that can help wrap their arms around us. For other people, we don't have somebody like that in our lives. So recognizing where can an outside community oncology counselor, someone like myself in your local community, be available to you so you can vent the emotions you're feeling, feel heard, and get support. So important. Number 5, lastly, incorporating integrative medicine. So integrative medicine has been this big concept that's gotten larger in my community and hopefully in yours too, of things that you can incorporate to help you optimize your health, where we've got conventional medicine, but then also integrative medicine of tools that can help decrease fear by doing things within your control. Meeting with your integrative medicine in your community can help you feel like you're doing something within your control for your health, especially when you're post-treatment. Some people incorporate this along the way within treatment, but for a lot of people, when they have the time and the energy, as treatment is ending and you want to do things to feel like it's within your control to help optimize your health. So, right, moving forward, here are the coping tools and integrative medicine things that can be helpful. Counseling, like I'm describing. Journaling can be a really helpful tool that you can do in all different ways along the treatment path. Mindfulness and meditation, breathing exercise and yoga, art therapy, acupuncture. Acupuncture can be huge in the world of neuropathy, as well as anxiety and lots of other things that you may be experiencing. Oncology massage, Reiki, healing touch. So those are all things to consider to help you manage the feelings of fear and anxiety as well. So next, I'm going to talk about a breathing technique that can be really helpful in centering when you do feel like that feeling of anxiety is just rising up in your shoulders and your neck. There's different types of breathing exercises. There's Andrew Weil's 4-7-8 breathing you may have heard about. That's great. There's also this example that I'm going to give you today. I talk about 4-4-4 breathing or box breathing. This square breathing can help regulate your nervous system, lower your blood pressure, over time treat insomnia. It's used by Navy SEALs even to stay calm and improve their concentration in tense situations. The idea of the box is that you're going to inhale for the count of 4. You're going to hold for the count of 4. You're going to exhale to the count of 4. Then for some people, it's sort of like a second exhale or a rest up to the top of the box. You can change the numbers based on what breathing is most comfortable for you, but just the idea of this 4 steps in the process can help really regulate your breathing, bring you a sense of calm. You can do it whether you're looking at your ceiling at nighttime, even though that may not be a square, that's okay. You can do it sitting in the doctor's office waiting room, tracing that square on the palm of your hand. You can do it standing at your bathroom sink, washing your hands. So I'm just going to demonstrate this with you because I think it might be really helpful to give you an idea of how you want to take your time with this. And I would recommend doing it just like 4-4-4 breathing, doing it 4 times. It'll only take probably 2 minutes. So if we start at the upper left-hand corner of the square, you're going to breathe in through your nose. That's the other piece, breathing in through your nose, out through your mouth. So 1, 2, 3, 4, inhaling, pausing, 1, 2, 3, 4, and then exhaling through your mouth, 1, 2, 3, 4. And then, like I said, for some people, there might be a second exhale. 1, 2, 3, 4, rest is okay too. So the idea, in through your nose, out through your mouth, and just sort of going along that square. And if you want this slide, I can make sure I can get this to you later as well. Another tool that can be helpful are meditation exercises. So I tried to pull up one today that might be really helpful. And if it resonates with you, wonderful. If not, right, there are different coping tools for different people, whether it's a breathing exercise, a meditation, or a visualization. For this one, it's called Phrases of Love and Kindness. So you can do this exercise with your eyes open or closed, seated in a comfortable position. I want you to take 4 deep breaths in through your nose and exhale through your mouth. Slowly with focus, begin the exercise below. So our first step is to wish ourselves well and repeat the following. May I be happy. May I be healthy. May I be safe. May I live in peace. Next, call to mind someone who inspires you. Say their name and picture them. Direct these phrases of love and kindness towards them. May they be happy. May they be healthy. May they be safe. May they live in peace. And then lastly, call to mind someone having a difficult time right now. Say their name and picture them. Direct these phrases of love and kindness towards them. May they be happy. May they be healthy. May they be safe. And may they live in peace. Take a minute to take another deep breath. My hope is that sort of left you feeling more centered, grounded, being where your feet are, knowing as you have fears, right? Our fears are surrounding life can encapsulate lots of different things happening all at the same time. Our next slide is the additional resources like I talked about. So the first one is the book I mentioned early on, Prepare for Surgery, Heal Faster, a guide of mind-body techniques by Peggy Huddleston. And what I know about this book is there's also a CD that goes along with it. If anybody still has a way to play that CD, that is, it can be really powerful, has great meditation exercises in it. Another one is called The Cancer Fighting Kitchen by Rebecca Katz and Matt Edelson. I put this in here because for so many people, there's that stress and fear of what to eat and what not to eat. And this is a great book because not only does it have beautiful pictures and delicious recipes in it, but it really has some information also on if you're experiencing this, like a metallic taste, try this. If you're experiencing nausea, try this. So it can reduce our fears by having something right in front of us that can help give us guidance. Another book, When a Parent Has Cancer, A Guide to Caring for Your Children by Wendy Schlessel-Harpum. And that's a great book. Another great book, or another resource, is the internet site Bright Spot Network. Has lots of tools for families with children. It has books of how that you can go over with your children, books for yourself. It has discussion guides in it. It has activity pages, all different things to help you so you feel like you're not alone. Then lastly, like I did the one meditation with you, but Insight Timer at the bottom is a great resource that's free and can give you lots of meditations, progressive muscle relaxation exercises, all things you can tap into. I encourage you to go on that website when you're having a good day, not when you're struggling and feeling more panicked, but when you're having a good day and can really explore what you can find that's free on that website. I know there's others like Calm and Headspace. Headspace even has a Netflix documentary that you might find helpful. So just know these are some of the top resources I share with my clients. So lastly, right, for mindful moment at the end, just like if anybody watches the Sunday morning CBS program, Your Moment of Zen, here's these same waves in the ocean. Taking in the 5 senses, if you were right in the raft, on a raft in this body of water, what would you be seeing? What would you be hearing, tasting, touching, smelling? Those 5 senses, riding those waves. The emotions come in, but they can also pass. So feeling like you can manage it. Again, my name's Elyse Adams. I work with Novant Health Cancer Institute Buddy Camp Support Center in Charlotte. I hope that this presentation has been helpful. I know I've squeezed a lot of information that I go through in many sessions with clients today. But if nothing else, right, I hope we have normalized these fears, talked about a lot of coping tools and strategies so you can feel like you can manage. Know that having an oncology counselor along the way can really serve benefits, whether it's through your cancer institute or somebody in the community, to help you feel like you're not alone. Reach out to me if I can help clarify anything from the presentation, or you want any of the specific slides that I mentioned with tools. Have a good rest of your day. Be well.